Welcome back to At the Heart of Health. We've been learning a little bit about what a nurse practitioner does and what urgent care involves. You know, Paula, there's been some negative perceptions about this term, doc in the box, that you're stealing patients, but it sounds like what nurse practitioners do is really meet the needs of patients when they need it the most. We're going to go back to some more questions. Let's go to one from Florida. This person writes into Heartwise Ministries, what are the most common health problems that are evaluated in urgent care centers? What do you see on a regular basis?
Well, Dr. Marcum, it always depends on what type of, what time of year it is. This being the winter-fall season, typically what we see is cold and flu, bronchitis, pneumonia, sinusitis, things like that. In the spring, we tend to see more seasonal allergies. High population is that. In the summer, we have a lot of minor injuries, sprains, lacerations, broken bones, and then a lot of rashes like poison ivy and poison oak. The fall again, the repeating of, the cold and flu season. And then, of course, intermixed with all of that are our, patients that we see as a primary care, and then other complaints that we've discussed that have to be sent out, referred to other physicians or to the emergency room.
So our listeners might be interested. Conditions like lacerations. Let's say I cut myself real bad, I might need a stitch. Can you take care of that?
Oh yes, the urgent care would be the great place for that, for that patient to go to, where the emergency room where they can do a great job there, but their wait may be long, and urgent care is the perfect place for them to go.
Or someone might have a son out there that's playing soccer, and you think that the leg might be broken, but you're not sure. That's another type of problem you could take care of.
Yes.
So they might not have to wait in line at the emergency room quite as much.
That's right.
And it's very hard to get a primary care doctor's an appointment that same day. Now I have a question. If you see someone else that sees a doctor on a regular basis, are you giving them records, or do you follow up with the primary care doctors? We don't want, you hear this thing if someone's stealing someone else's patients. How do you interact with the other healthcare providers that might already have a relationship with someone else but just need your services acutely?
Right. In the practice that I work with, we try to always encourage our patient on our discharge notes to follow up with their primary care physician, if they're not improving, or just to let them know what is going on, because it is very important that they maintain that relationship with their primary physician, and we want to maintain a relationship with them also. Some patients do warrant us calling them and speaking with them directly while that patient is there, so we can get a little better history. Medical records aren't standardly sent to their office automatically, but if requested, we always send them.
If you did an EKG or X-ray or some blood work, you could do that?
Yes.
Do you ever see any patients that just run out of their medicines and they can't get a hold of their doctor on the weekend that need refills?
Yes, that is quite common.
Now, how would you know, that they're, how would you know that a patient's actually telling the truth about their dosage of their medicine and the condition is a correct diagnosis? Does that ever come up?
Well, that can be difficult, but
I guess you could call the pharmacy.
With technology being as it is, we can call the pharmacy where they get them filled, ensuring that it is the correct dose. A lot of patients, though, we find these days with more and more education, they actually have lists of everything written down, or a card that they carry that has everything explicitly written out.
Wow. Let's go to another question. This comes from the great state of Wyoming out west. And this gentleman writes in, if I went to an urgent care center and needed to be hospitalized, would I have to repeat the testing that was done, and how are the records? We talked a little bit about records. So let's say someone goes and you say, well, this isn't something we should take care of. You need a higher level of care. What would you do next?
Well, we would communicate with the hospital that this patient is coming, if necessary, send them by ambulance. But we do send our records, our notes that we did in the clinic, send the X-ray films and the lab work that we did, copies of the EKG. So some of that won't have to be repeated, and their care can be expedited on the other end.
So this would really be a valuable service, because you could actually help a patient get to a higher level of care more quick and actually triage them right.
We do always hope that those patients choose the emergency room first,
right,
because that would, expedite their care much quicker. But yes, we can expedite that for them very well.
Now, if you needed, you could actually call an ambulance, and I'm sure that happens occasionally. You get someone say, hey, listen, you shouldn't be here. We got to get an ambulance, take you where you need to go.
It does.
Well, that's very interesting. So that, I guess the question there is if they wouldn't repeat the testing if you did any. I'm sure if they had an EKG, you would forward that. If they had an X-ray, you'd move that forward too. Okay. Let's go to another question here. This is a very good one. It says, I love going to urgent cares, but I like to pay cash. And this person likes it because there's no wait and they can be anonymous. They don't think, I guess, people can track them. I don't know. Why do you think urgent care is so popular, and why are nurse practitioners growing when it comes to people deciding to get their care from this source of healer?
Well, the last part of that question, about why a nurse practitioner, me being biased, of course, we as nurse practitioners feel that we just add that extra, compassion, that extra nursing element that they may not find. Now, granted, the physicians do very well at what they do also, but as nurse practitioners, we feel that we can give the patients a little something else that, maybe they don't get, from their physician. As for the first part of the question,
anonymous. This person wants their privacy protected. But they would have to give their name, wouldn't they?
That's an interesting question because, well, I can think of some situations, yes, where patients come in and, under the HIPAA Act, all information is protected. Right. If they're paying cash, not taking an insurance card, But
you can see in a small town, you go to the emergency room, lots of people see you, people talk.
A name is still taken with the date of
Right.
birth and that, Social Security number may not be necessary. But no, information is very protected.
Right. Well, that's a good point to bring up. Now, I'm curious, this year on At the Heart of Health, our theme is At the Heart of Health is Love. Because we believe that the healing force is love. Unless you have love, you can't be healed ultimately. How does a nurse practitioner show their spirituality and love in a clinical and sometimes brief situation where you might not ever see the patient again? Would it be by example, or do you actually, talk about spiritual things with them, or how does that handle?
Well, when you are in a urgent care setting, time is limited, so you have to choose how you can best be of example. I have found that by leading by example, showing kindness, always smiling, looking the patient in the eye, touch is very important, letting them know that, you meet them where they're at, just like Christ did, with us and how he healed. He met people where they were at. He treated unconditionally, non-judgmental. I try to, have that also in the type of care that I give.
Now, do you see a nurse practitioner as a healer?
Oh, absolutely. I see, a school teacher as a healer. I see, a policeman as a healer. All of us can be healers, whether it be a mental healing, spiritual healing, physical healing. We all can play a role in that.
Well, I think that's a very good point, because in this world we think that, healing only can come this way or this way. But everyone that changes chemistry, interacts with person, can be a healer. And I think that's and this is what's so neat about explaining different types of healers on At the Heart of Health, is we're able to communicate to our listeners that yes, even our listeners out there can be healers. Just by smiling and laughing and touching, having love in your heart, you can help heal the world. So that's very interesting. Let's go back. I think we have time for one more question here. This is a good question, and we might not be able to talk long about this. Would an urgent care clinic be a place to go for weight loss? Now, we don't want to talk to weight loss, but we want to say, do some urgent cares handle weight loss and other different issues? So this is sort of a general question.
Yeah, I do know that some urgent cares do provide this type of specialty. In a patient searching for a particular type of weight loss, what I can encourage them to do is look for a facility that actually provides an examination. Not just giving you medication and sending you on your own, but actually providing lab work, EKG, screening you to make sure whatever particular type of weight loss they are providing, that they are the right patient for it.
Now, these are big, important issues, because as our society gets more heavy, we're going to start having more health problems. And I think if people can just go and get good referral sources, or if this is something a clinic does well, I think weight loss is very important in healing and treating, and that's very comprehensive treatment.
Yes, as you know, a lot of our diseases come from, obesity.
Now, Paul, I'm going to interrupt you here. What do you like best about being a nurse practitioner? What makes you happy?
Well, I really...
I know the hours are hard, and you're meeting someone different every day. What do you like the best?
Well, I really enjoy just the one-on-one, relationships, although they may be just brief, but the impact and the relationships that I develop with patients on a daily basis and how I can make a difference in their lives.
And for you, it might be one of many questions, but for them, these are sometimes the most important encounters that they ever get.
Right.
And if they can have a little love there, you can really change their whole outlook. Well, I think we've learned a lot today about what a nurse practitioner is, the services, the advantages, the disadvantages of going to a nurse practitioner. I want to thank you for being with us today.
Thank you.
If you might have questions for us at Heartwise Ministries, you can get a hold of us. Go on the computer, send us an email at heartwiseministries.org. Or if you don't have a computer or want to write, you can get a hold of us at Heartwise Ministries, P.O. Box 8, Ottawa, Tennessee 37363. And as you, friend, explore your healthcare needs, I want you to remember, as we talked about today, that at the heart of health is indeed love. And when you have love in your life, a special relationship with your Creator, we can all be assured of ultimate healing. Thank you for joining us.